Patient-centered medical home is a nice agglomeration of terms, but if you break it apart, patient-centered really it means we've turned the focus of healthcare delivery from the deliverers to the patient. From a patient's perspective, the ability to pick a practice that has that designation for patient-centered medical home really gives them a sense of assurance that practice has in place the mechanisms that provide the core elements to patient-centered medical home healthcare delivery. The National Center for Quality Assurance has set up a system of grading for practices. They've established 3 levels. Level 3 is the highest level of achievement that you can get from this, and that's where we sit now. The clinics within Memorial Physician Services had to sit down and take a hard look at a variety of both structural and process elements to get that level 3 designation from NCQA. The types of things that needed to be in place was to make sure that there was a very clear definition of how patients can access the practice in healthcare, how they can get their care coordinated through us, and how we look at quality. Not that quality is a problem, but that there's always an opportunity to make it better. The cornerstone, if you will, of the practice's success in patient-centered medical home is continuously going back and looking at what we do and how we can do it better. Traditionally, healthcare delivery has been provider-centric. It's been focused around a physician's schedule, for example. It's been very directive and in large part reactive. I have something going on, and so I need to get that attended to. Patient-centered medical home changes that emphasis, puts the patient in the middle of that process. Now the patient is a member of their own healthcare team, and not just a member, but a very important member. One of the difficulties with the complex delivery of healthcare is the number of people who deliver that care. Never more important for primary care to know all of those essentials. So a patient that we send to a specialist or that we send to the hospital, we have communication lines established with those physicians and those facilities to get them information about the patient, and that they can get us information back so that we can pick up that patient's care. We like to work with the patient to find out what works best for them so that we can put things in place that will actually succeed. Getting access to the providers, I think, is going to be easier simply because we're looking at that teamwork process with this. It's not just a physician, it's a physician. It may be a nurse practitioner or a physician's assistant. It may be our nursing staff, our front staff. Everybody's a part of the team. So I think what they'll see is an easier entry point and a more seamless process to get their health care delivered.